California has one of the worst homelessness crises in the country. In 2022, there were an estimated 172,000 people experiencing homelessness in the state, the largest homeless population of any state in the U.S. There are a number of factors that have contributed to California's homelessness crisis. Affordable housing shortage. California has one of the worst affordable housing shortages in the country. This means that there are not enough affordable homes for low-income families and individuals. The state's median rent is now more than $2,000 per month, and the cost of housing has outpaced wages for many years. This has made it difficult for low-income families and individuals to afford housing, and has pushed many people into homelessness. Mental illness and addiction. Homelessness is often linked to mental illness and addiction. California has a higher rate of mental illness and addiction than many other states. These conditions can make it difficult for people to maintain housing. For example, someone with a mental illness may have difficulty holding down a job, which can make it difficult to pay rent. Or someone with an addiction may spend all of their money on drugs or alcohol, which can leave them unable to afford housing. Income inequality. California has one of the highest levels of income inequality in the country. This means that the gap between the rich and the poor is very large. The rich are getting richer, while the poor are getting poorer. This has made it more difficult for people at the bottom of the economic ladder to make ends meet. For example, someone who is working a minimum wage job may not be able to afford housing, even if they are working full-time. Rising cost of living. The cost of living in California has been rising steadily for many years. This has made it difficult for people to afford basic necessities, such as housing, food, and transportation. For example, the cost of food has increased by more than 50% in the past decade. This means that people are spending more of their income on food, which leaves less money for housing. Lack of affordable healthcare. California has a large number of uninsured and underinsured residents. This means that many people do not have access to the healthcare they need to treat mental illness and addiction, which can contribute to homelessness. For example, someone with a mental illness may not be able to afford the medication they need, which can make their symptoms worse. These are just some of the factors that contribute to California's homelessness crisis. The state has taken some steps to address the problem, but much more needs to be done. In recent years, California has invested billions of dollars in affordable housing and homelessness prevention programs. The state has also passed legislation to make it easier for people to get back on their feet after experiencing homelessness. However, these efforts have not been enough to solve the problem. California's homelessness crisis is a complex issue with no easy solutions. However, the state must continue to invest in affordable housing and homelessness prevention programs if it wants to make a real difference.